Ladies and gentlemen, please take your seat. The program is now beginning. Ladies and gentlemen, we ask that you please take your seat so the program can begin.
Ladies and gentlemen, please take your seats. The program is about to begin. I'd ask that everyone please take their seats. Thank you so much for joining. We'd like to get started ASAP. Please take your seats and thank you so much. Folks, please take your seats. The program is about to begin. Please take your seats. Folks, please welcome your current and former governors of Massachusetts.
excited to see all of you, and welcome. We are going to do our best to make sure that all of the effort it took for you to get here is worthwhile. And I would like to start by recognizing who is in the room. So if you were here 20 years ago, could you please rise as you are able? Oh my goodness. Wow. Stay standing. Hold your applause because I got a short list, okay? If you helped turn the law that Governor Romney signed 20 years ago into coverage for Massachusetts residents, you wrote policy, you wrote reports, you hit the streets to sign people up, please rise. Yes. If you lobbied for changes, or ate alone at night, or put the kids to bed by yourself because you had a partner who was doing all of the hard work, or if you got coverage through the connector, could you please rise? I can't imagine who I missed, but you have to stand too, because this whole effort has been collective, and it will continue to work and succeed because of all of your efforts. So, my round of applause. Thank you so much. And with that, I'm going to hand off to the Health Connector's Executive Director, Audrey Morse-Gasteyer.
Good morning. It is wonderful to be with you all this morning. 20 years ago, Massachusetts took a chance on a bold premise that we could solve one of the most seemingly intractable problems of our time, the problem of the uninsured. The elegance of the policy levers inside of Chapter 58 is hard to dispute. This was precision engineering, using groundbreaking market reforms, new individual and employer responsibilities, the creation of a competitive insurance marketplace, the Health Connector, to facilitate access to coverage. The law did exactly what it was set out to do. By the fall of 2008, uninsurance among adults had dropped by nearly 70%. Today, Massachusetts boasts the highest rate of health coverage in the nation at over 97%. So yes, the Chapter 58 story is one about careful, resilient policy design, but it is also a story about trust and courage. It was about people being willing to take chances on other people and take chances for other people. In late 2006, an unqualified health policy graduate student audaciously emailed the then 7-month-old Health Connector to ask for an internship. A few months later, they put me to work at a makeshift desk in a hallway, learning at the feet of the first wave of implementers, trying to figure it all out. I've been working on Chapter 58 in one role or another ever since. As a result, I've had a front row seat to the people who brought this law to life. The reg writers interpreting the law, the IT staff coding eligibility changes, the commissioners charting the way, the waiver negotiators, the lawyers keeping us out of trouble, the junior staff keeping us real, the advocates keeping us ambitious, the industry leaders keeping us attuned to their business realities, the Connector executive directors leading a kind of organization that had never been conceived of before and had no blueprint or peer, and the frontline assisters bringing uninsured residents into the security of coverage, one application at a time. The people who designed the law and got it over the line, legislative leaders and their staff, Governor Romney and his team, advocates, think tanks, business groups, lions of the Senate alike, had a seriousness of purpose that remains just as deeply held by the individuals that have been stewarding over it ever since. In the Chapter 58 story, the architects, placed trust in the implementers. They passed the baton to continue the race. As we planned today's event, the outpouring of enthusiasm from architects and implementers alike has been remarkable and moving. It is clearer to me than ever how much meaning so many of us, so many of you in this room, drew from the relationships and the trust that this work was built on. Many of you have told me that your work on this life-saving law and how it influenced the entire nation was your proudest professional experience. And your eagerness to cast the net of credit widely was telling. Many said things like, "Promise you won't forget to include this other person. They worked so hard on this too." The vibrancy of that spirit that allowed for Chapter 58's success in the first place remains. Many of the people who made it possible are here in this room, many who've traveled from all over the country to be here. There are deep and enduring friendships, personal losses, lessons, and batons passed in this room and part of the larger fabric of this story. While we recognize today the distance traveled, I want the crafters of this miraculous law to know that those of us on the ground administering these programs and policies every day endeavor to bring that same spirit to this work and to summon it in the face of new headwinds our healthcare system now faces. On behalf of those who picked up the baton that you passed, thank you for trusting us to be stewards of your vision for a healthier and more secure Massachusetts. And to everyone who has joined us today, thank you for being a part of this special gathering. And a special thank you to my amazing staff at the Health Connector, my predecessor executive directors, our board of directors, our board chair, Secretary Mahania, and Governor Healey. And speaking of governors, we have today the rare honor of having 5 governors of the Commonwealth of Massachusetts. Governor Healey, Governor Patrick, Governor Romney, Governor Weld, and Governor Dukakis are here with us today, gathered together in this historic space. These 5 governors from both political parties share in a legacy of public service to our extraordinary state across 6 decades of Massachusetts history. We are especially happy that Governor Dukakis was able to join us today, and I ask you to join me in thanking him. We are so pleased to have on the stage Governor Healey, Governor Patrick, Governor Romney, and Governor Weld. And now it is my distinct honor to first introduce our incredible Governor Healey.
How about another hand for our fabulous Executive Director, Audrey Gasteyer, for your exemplary leadership and stewardship. To you and the team, thank you for putting this party together. I wish you could be here and see this room and take in something really, really special. And I think particularly given the moment that we're in as a country, it's just all the more meaningful to look out and see people of such goodwill who worked so hard with a common purpose and a common mission to get something remarkable done. It's a testament to the hard work of so many people who worked hard to have the vision for this, who worked hard to actually get this law passed through any number of conference committees, we know, and to get this law signed, and then to get this law implemented. It's hard to believe, 20 years, time flies, right, when you're having so much fun in healthcare. This is a day to celebrate that and to thank everyone who made it happen. And also to take some lessons from all of that into the work today. It's a true honor to be on this stage in this room, which has seen so much action over the last couple hundred years, to be joined by my predecessors, Governor Romney. It's an honor to have you back here in Massachusetts. I was going to say some other nice things, so really, truly, 20 years on, after all that hard work that you put in to pass and then sign this into law, to sign Massachusetts health reform into law. You then, of course, went on to do incredible work as a United States Senator and so much more, and we are proud that your impact began right here in Massachusetts. I also want to acknowledge your fantastic Chief of Staff, Beth Myers, who's here. As well as a woman I was often confused with, our fantastic Lieutenant Governor Healey, who's here. We both spell our name the right way. And to Governor Patrick, whose job it was with your team to implement that law. We benefit so much from the incredible work that you and your team did in that implementation. We also benefit from the work that you did, particularly establishing Massachusetts as the global hub for life sciences. And today, I know I'm proud to always propose and then to see funded the Massachusetts Life Science Center and the Massachusetts Life Science Initiative, which really continued to elevate our state's economy and, in addition, of course, unlocking incredible cures and treatments, saving lives here and around the world. So to Governor Patrick, thank you for being here today. And I want to acknowledge as well a fellow who began once upon a time. He was your Chief of Staff, the great Senator Mo Cowan, who's also with us today. And to Governor Weld, I'm sure you have a lot to reflect on in this moment, but I want to thank you for laying the groundwork for this progress. I want to thank you, too, for your commitment to bipartisan work here in Massachusetts, particularly along the lines of education reform, where we're proud, once again, to be at the top of the nation's ranking. So thank you so much for being here today, Governor Weld. And of course, to our longest-serving governor, the architect and driver of the Massachusetts Miracle, and a role model we all look to for what it means to be an incredible public servant, Governor Dukakis. So I exercised a point of privilege by spending some time on the governors, all right? I understand, though, none of this happened or would have happened without the vision and the work of the teams in the legislature. And it is truly something, and I'm looking at portraits that hang in this auspicious hall of early lawmakers and what they brought forth. And I'm just so delighted that we have so many folks from the legislature who are here with us today. Special shout out to Speaker Mariano, who's continued to lead on health care for our state. Speaker DeMacy, wonderful to see you. And Speaker DeLeo. We also have Leader Tar with us. Thank you all. And then, of course, we have Travis here, Senate President Travellini is here. And of course, Senate President Terry Murray, who is probably doing a lot of the work in those conference committees. But we thank you. We thank you for your hard work and your leadership in making health reform a reality, along with all of the legislators, current and former, who are here with us today. Thank you for all that you do. We also this morning feel the presence of a very special person, don't we? And that is Senator Ted Kennedy, who was Senator Kennedy, of course, was in this hall 20 years ago, and he did so much to advance health care for Americans, and he did so bringing his values, which we know well here in Massachusetts, having seen him living it and practicing it for decades, the values of care and compassion. And while we miss our dear senator, we are so delighted that Ambassador Vicki Kennedy has joined us here this morning. There are too many people to recognize, or we would run out of time here, I know, but I do want to thank everyone who contributed to these reforms and their implementation over the years. We see cabinet secretaries, agency officials, Health Connector staff, hospital leaders and insurance leaders, advocates, organizers, faith leaders, all the people representing all parts of our state. Everyone who shared their experience and their struggles with a lawmaker. Everyone who went to a rally on the Common or at the State House. Everyone who talked to their neighbors or their congregation. Everyone who believed that Massachusetts could do this and should do this, and then stood up to make this happen. Thank you, thank you, thank you. You proved what's possible when we look past partisanship and instead set our eyes on the common good. You proved what's possible when we come together and we focus on getting the job done. And by doing that, you proved that government can do great things. In Massachusetts, we're going to keep working together to do great things. And that's the lesson of Massachusetts healthcare reform. It was all of the Commonwealth approach. That's why it happened. That's what we're about as a state. And that's why it stood the test of time. It represents who we are, what we're about, and what we will always be about. 250 years ago, the people of Massachusetts stood up. They started a revolution that gave us our country. That's why it was such a fitting choice to select Faneuil Hall 20 years ago for the signing of that remarkable piece of legislation, right here in this very hall. A place where Sam Adams stood up to an empire, where Frederick Douglass stood up to slavery, where Susan B. Anthony stood up for women's rights, and where thousands of immigrants have become proud Americans. Today, we celebrate more than the revolutions that started here in Massachusetts, but they are something to note. Revolutions in care, from anesthesia to heart transplants to today's AI-enabled discoveries. Revolutions in policy, epitomized by this very healthcare reform law we celebrate today. Thanks to the people in this hall and beyond, Massachusetts covers more of its residents with health insurance than anywhere else, as Audrey just said. And because of that coverage, people in Massachusetts are living healthier, longer, and better lives than ever before. And because of the model that our law created, millions of Americans today can say the same. And that's not to say that our work is done, far from it. Today in Massachusetts and across the country, we face a cost crisis. Too many people are asking, not can I get coverage, can I afford health care? And too many people are looking at Washington, D.C. and wondering, does my government even care? Our nation's healthcare system is broken. And Washington's not going to fix it, certainly not anytime soon. And that's a revolution, I think, that we need to lead again, right here from Massachusetts. Now, look, last year we took some steps. We cut copays, we cut deductibles for the first time in history. We worked with our insurers to eliminate prior authorizations for routine and ongoing care. We work with members of our groundbreaking Health Equity Compact, some of whom are in the room today, to bring affordable care to all communities. And when the federal administration cut trillions from our healthcare system and stripped premium supports from our Health Connector members, we found the funding to protect affordable coverage for 270,000 households here in Massachusetts. Now I've appointed a group of leaders to develop proposals to bring down costs across our healthcare system. They're here today, and I want to thank members of our Healthcare Affordability Working Group. They know that I have called on them because we can't wait for Washington to come back to me with recommendations, short-term, medium-term, longer-term, things that we can try out, innovate, be nimble on, because that's what the times require. And that's what the urgency, the needs of people in Massachusetts require of all of us. And that's why I hope today, all of you members, and those of you providing input on subcommittees, leave with an enthusiasm that we can get this done, that we can actually do something to make it better for folks in our state. And maybe doing so, as we've done for centuries, lead the way for others to follow. Because the lesson of Massachusetts healthcare reform is that big changes require trust and courage and collaboration from everyone who has a stake. So on this anniversary, I am calling on everyone here to help us meet the moment once again. Today's challenge may seem hard, but Massachusetts, one thing we can always say is that we've done hard things before. We are uniquely capable of solving big problems. We're uniquely dedicated to bringing world-class care provided by our doctors and nurses to the people of our state. And we're uniquely committed to broad, deep, and bipartisan civic participation by all. This is our true heritage. This is what got us here today. Frankly, this is what our country needs from all of us. So once again, Massachusetts, it's up to us to lead. I know we have what it takes. It's the dedication in every healthcare center, hospital, office, and home in our state. It's the spirit here in Faneuil Hall today. So let's honor those who helped get us here. Let's celebrate what they achieved, yes, but let's be inspired to do the work that lies ahead. Thank you all once again for coming out today, and it is now my honor to introduce to you the 71st Governor of the Commonwealth of Massachusetts, Governor Deval Patrick.
Thank you, Governor Healey, and good morning, everybody. It is a real pleasure to be here with you, Governor Healey, with Governor Romney, as well as with so many people who helped conceive Chapter 58 20 years ago. I'm out of practice. And have carried the cause forward since. Healthcare for everyone is a common good. You made Massachusetts a national model for that proposition, a model for what determined, practical leadership, collaborating across all kinds of differences and all sorts of interests, can achieve in service of the common good. Once that new law was signed, it fell to a brand new administration to give it shape. A shout out to Judy Bigby, Leslie Kirwan, and all the folks in the Patrick Murray administration for being just the right team for the assignment. You are the team who figured out what terms like affordable and minimum creditable coverage should mean in practice, not by academic analysis alone, but by getting out and asking people in countless focus groups and conversations with grassroots organizers like Healthcare for All. You are the team who sorted through what the so-called fair share contribution should be, not by statistical and economic modeling alone, but by talking with small business owners and business leaders like Rick Lord and Paul Guzzi. You are the team who got the invincibles, I love that term, those young, healthy, uninsured, mostly men, who believe they would never be sick, but whose participation helped make the pool of insurance broad enough to work. You got them to sign up for coverage by getting the Red Sox and the Celtics and other sports organizations to make the pitch. You are the team who made the health collector a trusted source, who stood up a first-of-its-kind Commonwealth care, who took the aspirations of this landmark legislation and brought health insurance to 98% of the Commonwealth's residents. And when it was time to integrate the ACA, and the connector's website failed, you remember that? You are the team who stayed focused above all the noise, who remembered that Chapter 58 was never about a website, and who moved the number of insured at the time from 98% to 98.5% while the website was down. You accomplished this and so much more because you understood that healthcare was not an issue of abstract economics or regulation, but one of human dignity, and that policy matters most when and where it touches people. Not long ago, we had a contractor working on a small project at our home. He was serious, he was diligent, he didn't say much until he finished after a couple of days. And when I thanked him for his work, he gave me a note from his wife, whom I'd never met, thanking me, really this team, because the health care she was able to afford through Commonwealth Care saved her from previously undetected cancer. We're going to hear other stories like that today. I can't count the number of people just like that, whom I've encountered myself over the last 20 years. What you have all done and what you must continue to do matters. I used to joke, Governor Romney, that we'd done so much to make Romney Care a reality, we really should call it Patrick Care. But as I bring you... As I bring you to the podium, let me say on a serious note that I honor your role, not only in signing Chapter 58, but in setting the tone for its success. For the broad coalition of policymakers, business, medical, and labor leaders, academics, and grassroots organizations that you and Senator Kennedy and President Travellini and Speaker DeMasi brought together to invent healthcare expansion in Massachusetts, then stuck together to refine it and to strengthen it in the years that followed. It was never about perfection, never about ideological or partisan purity, never about having to agree on everything before we worked together on anything. It was about mission, and you set that tone, and it endured. When you signed this law, I was a long-shot candidate for governor out on the campaign trail, and a reporter asked me what I thought of this milestone. I paid you then a sincere compliment for this singular example of leadership. And that reporter, I think, was surprised. It must have surprised you too, because you called me to thank me for the support. Well, I'm glad now to have the chance to compliment you and to thank you again. Ladies and gentlemen, please welcome the former United States Senator of Utah and our former governor, Mitt Romney.
Thank you. Thank you. Thank you. What an extraordinary honor to be here with all of you today, the people who have changed so many lives in our great state. Thank you to Governor Healey for this commemoration and bringing us together and allowing us to celebrate a great achievement. Thank you, Governor Patrick, for implementing this law. My goodness, what a job. Wow, extraordinary, thank you. Also, Governor Dukakis and Governor Weld, what amazing people we have had leading our Commonwealth. Citizens of a great state have made an enormous difference for our children and for the people that we were elected to serve. Now, having spent 6 years in Washington, I have greater appreciation for what we did here in Massachusetts. I think there are at least three things that made a big difference. First, the political leaders who were part of this effort came to the job to get things done, not just to see what we could do to get ourselves reelected. I remember the first time I sat down with Senate President Bob Travellini in his office, and I think he said it best. He said, "Governor, the campaign is over. Now it's time to do the people's business." And that set the course of the next years. Second, political rivals respected each other, buried political weapons, and worked together to find solutions. Bob Travellini, Speaker Tom Finneran, Speaker Sal DeMasi, and I met every Monday to build trust, update progress, and solve problems. Senator Kennedy, the widely acclaimed Dean of Healthcare, collaborated with us. And I knew that without his blessing, this law would never become a real change element for the people of our state. As a matter of fact, on this stage at the celebration, there's only one line I remember from all the speakers, and that came from Senator Kennedy. He said, when Mitt Romney and Ted Kennedy are celebrating the same piece of legislation, it proves one thing: one of us didn't read it. Third, President Travellini and Speaker DeMacy and I were blessed with extraordinarily talented people that dug into the details, broke through the many roadblocks, and negotiated every single line of the legislation. Secretary Tim Murphy, my Lieutenant Governor, Carrie Healey, Cindy Gillespie, Beth Myers, Tom Tremarco, they led the team from my side. They not only put the legislation together, they guided the campaign to sell it to the business community, the healthcare providers, the media, and the people of Massachusetts. The idea from my side to get every Massachusetts citizen insured came from Tom Stemberg, of all people, the founder of Staples, the office superstore. He came into my office one day and he said, "Mitt, why don't you run for governor?" I said, "Tom, you've heard me many times answer this. I want to help people." He said, "Well, if you really want to help people, you'll find a way to get everybody health insurance." I said, "Tom, that's just not possible." He said, "But if you really want to help people, you'll find a way." And together we did. Thanks, you guys. A real honor to be here.
Thank you so much to the governors. Beautiful remarks. We're going to turn now to the people who really, we wouldn't have Chapter 58 without, in addition to these incredible leaders. Could I please have our legislative team join us? That's current Speaker Ron Mariano, Senate President Robert Travellini, and Speaker Sal DeMacy. And we are going to start with Speaker Mariano, who you all probably know has been at this for all these 20 years and is still carrying the torch. All yours.
Oh, my.
Yeah.
We need some time for these older gentlemen to make their way to their seats. You think I was going to be serious? There's no way I was going to. No way. Thank you, Martha, for the kind introduction. Far better than some of the stories you wrote about us when we were trying to get this done. But it is great to be back here at Faneuil Hall on the same stage where Governor Romney signed the healthcare reform bill into law. I happen to be in the back. I get crowded out. Some photos you can see my head. Most photos, it's just my bright pink tie. It's not lost on me that I'm the last one standing in elected office. Maybe it's my turn to be president. In all seriousness, my time working on healthcare reform was one of the most rewarding and impactful experiences of my career. Though I might not have said that 20 years ago, if you caught me after a grueling hours-long conference committee meeting, I had a habit of had a 3-ring binder, and when I was real aggravated, I'd sail it right across Sal's office when I came in. To say that the task before us was difficult would be an understatement. In fact, many said it was impossible. But we were all motivated by the opportunity to do something truly transformative, and by the stories that we had heard from our constituents who were counting on us to deliver meaningful reform. 20 years later, there's no question that the work of everyone involved paid off. Today, Massachusetts still has the highest rate of health insurance coverage in the nation, and the passage of the health care reform law is responsible. In other words, this law saved lives. And of course, Chapter 58 eventually became the model of the Affordable Care Act, which brought key elements of health care reform to the rest of the country and led to more than 20 million Americans gaining access to health care. Not bad for a bill that everyone said couldn't be done. Not bad for a bill that drew protesters outside the hall 20 years ago when we're saying it wasn't good enough. Fortunately, Massachusetts had the right leaders in the right time with Governor Romney, Senate President Travellini, and Speaker DeMacy. And of course, there was that spirit hanging over all of us, the spirit of Ted Kennedy, and his lifelong commitment to health care for every constituent in Massachusetts. In particular, though, we wouldn't be here without my friends, Trav and Sal. Or at least I certainly wouldn't be here without them. My involvement on this and how I get to play a semi-expanded role was one day after a grueling conference committee meeting in the Senate President's office. He grabbed me by the tail of my suit jacket and said, "Can you get the guy from the North End to speak to the guy from the East Boston?" And I said, "I think I can do that." And he said, "Well, Friday, let's do it." And that began an intensified meeting weekly as we plowed through the bill. These leaders were not just colleagues who shared a mutual respect, they were friends. And that friendship mattered enormously when things got hard. Unfortunately, ultimately, there were never any issues that a nice dinner in the North End couldn't smooth over. I want to take a moment to say a few words about Sal DeMacy. For Sal, this work was never abstract. He grew up in a cold water tenement. No hot water, toilet in the hallway, grandparents downstairs, in the shower 2 blocks away. He understood in his bones the challenges facing the working class and brought that experience with him to healthcare reform. And while expanding access to healthcare for the poor was personal for him, he never took disagreements personally. He also couldn't have had a better counterpart than Bob Travellini, whose steadiness and world-famous deal-making talents were equally essential every step of the way. I was honored to be folded into that partnership, and I saw firsthand how these two leaders used their policy acumen and political smarts to bring opposing viewpoints together and to craft difficult compromise. And let me be clear, no one at the time believed that this legislation meant that we had solved all of our health care problems. We knew this bill was first and foremost about access, but that containing costs in the long term was a separate challenge. 6 years later, in 2012, I was part of the creation of Chapter 224, which made Massachusetts a leader once again in healthcare. That legislation put in place limits on healthcare spending growth and established the infrastructure to help reach these targets. Today we're facing a new set of healthcare challenges that cannot be overcome unless we renew the same bipartisan commitment to improving people's lives that was on display on this stage 20 years ago. And let me just stress that one of the reasons we were successful is because we had a bipartisan commitment. We had a commitment from all segments of the industry to get something done, and we did. I think Massachusetts, the state that invented this model and handed it to the nation, has an opportunity to lead the way again. I hope that today's celebrations can inspire a renewed commitment in all the stakeholders here today to come together and tackle the fundamental questions in healthcare about what we pay, how we pay it, and who gets left behind when it doesn't go right. So with that, it's my honor to introduce my friend, the former Senate President, Bob Travellini.
Good morning, everyone. Rest assured, my speech was not written by the same person that wrote the speakers. I have no notes. What I do have are excellent instincts. A lot of what we do in elective office is perceived as routine and repetitive. And occasionally we all wait for an opportunity to dive into something significant, complex, and life-changing. That opportunity came to all of us. And what inspired each and every one of us, and Governor Romney touched upon it, was at the very outset, we were all committed to the mission. We were capable of putting aside egos, personalities, party affiliations for the good of the people that we represented. It was huge. There was a small cluster of people who were hoping that this train never left the station or this plane never got off the runway. But we all knew better. We understood the mission: expand access to coverage, improve the quality and the delivery of health care, and contain the costs. Simply said, very hard to achieve. There were so many pieces, so many players, so many vested interests that were concerned. I'll use that word, concerned. They should be. If they didn't want to involve themselves in the conversation and the collaboration, then decisions were going to be made on their behalf and in their absence. Dangerous for chief executives of medical facilities, insurance providers, product, doctors, nurses. And a funny thing happened in the infancy of this campaign. People bought in, and they wanted a seat at the table. And in order to maintain that posture and that position, you had to contribute. And it wasn't in the form of criticism. It was in the form of wisdom, experience, knowledge, and what was right. Governor Romney and I, and Speaker DeMacy, he touched on it. We met every week. We spoke every day. We told the truth. Occasionally. Sometimes we kept a few things quiet. But in the end, we all shared an understanding that what we were doing was historic and never done before. And it was going to save people's lives. And if you only have one life, make it matter. Do something good. Yes. The governor asked people to raise their hands in her remarks in the beginning of this celebration. I'm going to ask, there's only 2 people in this room that the governor of Massachusetts came to their house on Sunday morning, knocked on the door. When he knocked on my door, I thought he was drunk and lost. I said, what the hell are you doing here? Sal and I foolishly, we're not talking 1 weekend out of 6 months. And Debbie and Kelly looked at us and said, what's the matter with you two? You're so close. It's right there. Smarten up. And every step of the way, Terry Murray, Dickie Moore, Brian Lees, David Friedman, David Morales, and Christian Scordoni, and Arthur Bernard, Christy and Jason and Mary Ann, all the kids from the inner city were driving the bus. It's pretty powerful stuff. And you realized you had to be right. And in the end, I said to Vicki this morning, the most rewarding aspect of this whole experience for me was how close I got to Ted Kennedy and how often we spoke and how the conversation went and how proud he was that finally somebody was going to achieve his lifelong dream in his own home state that he wasn't capable of putting together in Washington. And then we invited him to come to speak to us, the Speaker and I in the Senate. And in 35 years in office, he said to us, you know, nobody ever invited me to make an address here. I was shocked. We must have did something right, because it's 20 years later, and I know you guys can be doing something else on a Monday morning than sitting in here. But that is, without a doubt, and we did a lot of things in the short period of time, that is, without a doubt, the crowning jewel for me politically in my career as President of the Senate. And I want to thank all of you. Deval, Governor, this was a magnificent, Audrey, hell of a job putting this together. I mean that. Well done. And thank you, everybody, for coming.
Speaker DeMacy.
I'm sorry, I fell asleep. I'm sorry. Please excuse my voice, but I'm a cancer survivor thanks to the good quality health care I get in Massachusetts. Little did I know that I'd be a recipient of the good efforts of Chapter 58, but I am. It's so wonderful to have an event like this. Thank you, Governor Healey, for doing this. I appreciate it so much. I can definitely say that the greatest honor of my 30-year legislative career was to be part of the collective effort to enact this landmark legislation that brought access to quality health care to not only hundreds of thousands in Massachusetts, but millions of Americans all over this nation. I say collective effort because it was bipartisan. It was involved with so many groups, organizations, individuals, all working together under the principle of shared responsibility. A great word, a great quote, shared responsibility. Each and every one of us contributed and were part of the solution. Where else other than Massachusetts can you get that? today, besides agreeing with everything else they said, I'd like to thank some of those individuals who really made this all possible. And first and foremost, I'd like to thank Governor Mitt Romney. Governor, you showed the nation what can be accomplished when you work productively and respectfully with an overwhelming Democrat legislature. What an accomplishment that was. And you were a gentleman every step of the way, a professional. And you stimulated the conversation. You created this from the very beginning. And I and everybody are grateful to you. And to the one we miss the most, special thank you to Senator Kennedy. What an amazing man. His passion for this issue for so many years was an inspiration and a guiding light to me every step of the way of this process. Without his encouragement and without his knowledge and ability, I don't think, it could have been done without him. To him, we should be all grateful. Thank you. To my cheers at the time, Speaker Ron Mariano, my conference committee members, Pat Walrath, who's here, Pat, I thank you for bringing your knowledge and your fastidious attention to detail. And the details were extremely important. That was invaluable. Thank you, Pat. And to Ron, I say this. I admire how you skillfully handled the negotiations in the conference committee. And for your patience. Abbi pazienza. Abbi pazienza means have patience in Italian, and that's what I would say to Ron. Every time he'd throw his papers in my desk, come in and he'd say, I can't stand that. And I say, abbi pazienza. He learned a little bit. I'm not sure he follows that today, but oh my God. And I want to mention someone who's also on that conference committee, Representative Bob Hargraves. Sadly, I heard Bob passed away recently, but he was quite a character. He kept us grounded and entertained by his sense of humor, which he had a keen sense of humor. And Bob, thank you. I know you're up there. And of course, to Bob Leo, who handled all the budget aspects of it, and to Minority Leader Brad Jones. Brad, you were magnificent. You were so helpful, so supportive of this bill. I don't think people give you enough credit that you were part of this whole process. So I want to give you credit today. Thank you. And of course, we can do nothing in the legislature without staff. Right, Bobby? Are you still there, Bobby? So to my staff, who worked on this when I was the speaker, first and foremost, Chris Hager. Chris, my health care counsel, who provided her expertise, knowledge, counsel, and advice, and was able to put many different complicated issues on healthcare into a comprehensive piece of legislation that turned out to be Chapter 58. You know, Chris, without you, none of this would have been possible. Thank you so much. And to my other staff members who worked with us on this, Mary Ann Kalia, who I know is back there. Thank you, Mary Ann. My chief of staff. And of course, the more infamous Jason Aluya, my legislative person. And believe it or not, the special assistant we had in the office at the time, just a young whippersnapper at the time, now the chairman of Ways and Means, Representative Aaron Michaelowicz. But last, and most importantly, to my colleague and my partner in all of this, and to my good friend, and I emphasize good friend, because relationships matter in this business. They matter. Here's a kid from East Boston and someone from the North End. And we didn't even know that Governor Romney knew where they were, East Boston. But he wound up knocking it on tour. That's how much he was committed to it. Could get this accomplished. And that's something. So to you, Trav, I love you, buddy. And I can't thank you enough for being my friend. Thank you.
Thank you so much, gentlemen. I'm going to ask you to go back to the front row, where we'll continue to applaud you in many ways, I'm sure. Kessia Moretta, Marty Barnes. Over the past 20 years, thousands of doctors, nurses, members of shelters and food banks, partners in the fishing industry have said, hey, can I help you sign up for health insurance? And people like Kessia Moretta worked the phones as a navigator, in her case in Lawrence, to help people understand how health insurance works. And we're also so pleased to have Marty Bacon with her, one of the hundreds of thousands of residents this law is all about. Thank you.
Thank you, Martha. Good morning, governors, distinguished guests, all of you. Whew. I am Kezia Moreta, and I am a navigator, a healthcare navigator. I just love that line. I also manage the Navigator program at Greater Lawrence Community Action Council, which is a social services and community action agency selected by the Health Connector to work closely with the resident at the Greater Lawrence seeking for health care coverage. It's been my privilege to be working with the Health Connector for 11 years, and I'm going to tell you why. Before I became a navigator, I was a Health Connector member myself. In 2012, I immigrated to the United States from my country, Dominican Republic. I came here as a single mother with 2 daughters. By that time, they were 6 and 10. Starting over in a new country, where everything is new, when everything is unfamiliar, it's not easy. I needed to seek health coverage for me and my daughters. That's when I learned about the Health Connector through the navigators at Greater Lawrence Community Action Council. They work closely with me in my native Spanish to help me understand the healthcare system. And their support and their assistance helped me and saved me. While I was enrolled in a Health Connector plan, I needed within a year 2 crucial surgeries. Without that coverage, I don't know what would have happened to me and my daughters. One day, I asked my navigator, Elizabeth, I will never forget her, how can I do this work? How can I help people the way you help me? And that moment changed my life. I became a navigator in 2015, and I am in front of you as a program manager. Today, the Health Connector provides me with a purpose, a mission to help others the way someone once helped me. Policies like Chapter 58, they are not just laws in paper. They are lifelines for families like mine. Access to health coverage is not only health insurance, it's peace of mind, stability, and opportunity. And that is why I am privileged to be a navigator and grateful to all of you leaders that make Chapter 58 possible. Thank you. Here with me is Marnie Bacon, and I am so excited to hear her tell her story. She's been a long time Health Connector member.
Good morning. I am Marnie Bacon, and I'm here to tell you how my access to affordable health care in this great state led to a potentially life-saving experience. First, I'd like to express my sincere appreciation for this opportunity to be here with you all to help mark such a special occasion. For much of my 25 years as a self-employed yoga professional, the Health Connector has provided me with meaningful access to services that contribute to my health and well-being. Due to family history, I have always carried a known risk for breast cancer. My mom, who will turn 80 in May, was diagnosed at age 28. A few years ago, my new primary care team urged me to have genetic testing, which confirmed a risk significantly higher than I had expected. From there, I met with a very well-organized series of healthcare professionals, and after much considerable thought, I had both of my breasts surgically removed as a preventative measure. If it weren't for the urging of one unforgettable nurse practitioner, I might still be living with a dangerous risk or a more serious diagnosis. I give thanks every day that I likely won't have to fight breast cancer. Beyond those facts, I want to emphasize that this journey was undeniably challenging, both mentally and emotionally in particular. Fortunately, I had an incredible support system along the way. And thankfully, because of the Health Connector, I could prioritize my recovery over financial concerns. In closing, I want to express my deepest gratitude, not just for the medical care that I've received, but for the peace of mind that comes with Connector care. Thank you.
Okay, on that note, we are going to take a 3-minute break. You can stand up, hug somebody you haven't gotten to yet. You can't leave the building if you want to come back in. 3 minutes.
Please take your seats. The program is about to begin. Please take your seats. We are about to start the program.
Okay, you have to sit down now. Everyone take your seat. Where is Tim? I need Tim. There he is. Either one.
Ladies and gentlemen, if I could have everyone take their seats, thank you so much. Our first panel is about to begin. Ladies and gentlemen, if I could have everyone take their seats, our first panel is about to begin. Thank you so much.
No, good to see you. Doesn't matter. Oh no, you're gonna stay in your seat. Yeah. Oh. Welcome back. Thank you all so much. Our first panel, as you can see in your program, is about setting the table for this historic reform and the somewhat unlikely partners who came together. So I'll introduce them from your left. It's John McDonough, who then was the Executive Director of Healthcare for All, everybody? Gotcha? Yeah. Okay. Andrew Dreyfus was the president of the Blue Cross Blue Shield of Massachusetts Foundation back in 2006. Tim Murray, Jesus. I made that mistake in writing several times too. That was really embarrassing. Tim Murphy was the Health and Human Services Secretary for Governor Romney. Rick Lord was president of the Associated Industries of Massachusetts, and Christy Hager, as you heard the speaker introduce her, excuse me, was the Chief Health Counsel for Speaker DeBasi. So we're going to start with John. We're going to sort of do a little bit of chronology here and how this all came together. And John McDonough was with us back in the 80s and 90s in the area of the Dukakis administration when there were some critical laws that became the foundation for Chapter 58. And John, I'm wondering, when you look back at those foundational pieces, you recognize some pieces that were missing in the aftermath. And I wonder if you could tell us about one of those moments that you figured out where there was a piece missing and what you did about it. Go.
So thank you, Martha.
You're welcome.
And thanks to the governors for being here. Thanks to the legislative leaders. By the way, you have in your bags a button. I have one of the original buttons from 20 years ago that I've saved. And you know it's the original because on the back it says, "Made in Mexico." I will get to your question. I just want to give a little bit of a look back over, because we look back 20 years, but if we really want to get the totality of what this experience was, we have to go back 40 years to the 1980s, to the years of the Dukakis administration, where we had people like Health and Human Service Secretary Phil Johnston, who passed away earlier this year, Senator Patricia McGovern, lots of folks who really made the first dive into achieving broad healthcare access reform for Massachusetts, created programs like the Common Health Program to allow persons with disability to go to work and keep their health insurance, the Medical Security Plan, the Uncompensated Care Pool. All of those foundational elements were laid in the 1980s. And then we jump forward to the 1990s during the Weld administration, when Charlie Baker was first health secretary, later secretary of A&F, and Bruce Bullen ran the Medicaid program. And in those years, Massachusetts got its very first Medicaid 1115 waiver, reinvented Massachusetts Medicaid into Mass Health, and laid some important foundational elements that enabled Chapter 58 to happen. Among them, Bruce Bullen negotiating with Bruce Vladeck who ran the Healthcare Financing Administration then, and creating the special supplemental payments to disproportionate share hospitals that brought literally millions and millions of dollars into the state to support the healthcare safety net. So it was in 2004 when the then CMS, Centers for Medicare and Medicaid Services, the head of Medicaid, announced to our secretary that that extra hundreds of millions of dollars that we've been getting yearly, they hope we enjoyed it because they weren't going to give it to us anymore. And it was that announcement that became the focusing event that really got everybody on board to create what became Chapter 58. It was addressing an emergency facing our healthcare safety net system that created the opportunity that otherwise, frankly, never would have happened. Sometimes you turn lemons into lemonade. This was lemons into all kinds of amazing stuff that happened out of Chapter 58. So just understanding that there was a process by which it happened, and that process continues. Every subsequent administration had, after Governor Romney's, had its own emergency, its own strategic inflection point where we were either going to save and strengthen what had been built or you're going to see it decline. And every governor since then, whether it's Governor Patrick, it was Governor Baker, Governor Healey, stood up and addressed the urgent need to keep it going. And I say that just to give a sense of how this is a continuum. This Chapter 58 was not a de novo solo event. It is part of a fabric, of a texture, of policy changes that have kept this alive and that will be required. So the generation of activists and policymakers and leaders who are here today are facing their own special set of challenges because of the One Big Beautiful Bill Act, which is doing severe damage to Medicaid, and the threats to the Affordable Care Act structure. So those require us to stand up. So just want to close with one quote. It's a quote from someone who's been mentioned a lot today, from Senator Edward Kennedy. He gave it in 1980 at a special moment when he was suffering a significant loss. And here's his quote. He says, "For all those whose cares have been our concern, the work goes on, the cause endures, the hope still lives, and the dream shall never die." That's the message for all of you that I bring.
Wonderful. Andrew, when you were at the foundation, you commissioned a number of reports that built the business case for covering the uninsured. And you brought some of our top elected leaders to big public summits, put them on the spot. Are you going to do this? You also had to persuade some critical allies that a single state could do something without new federal laws. So could you take us to a couple of those moments?
Thank you, Martha. It's great to be here. So 2 short stories for you. The first is before the roadmap to coverage and before some of these emergencies were clear, the Blue Cross Blue Shield of Massachusetts Foundation commissioned a poll by Bob Blendon, the famous Harvard pollster and professor, to survey public attitudes in Massachusetts. And what we found was that Massachusetts residents overwhelmingly supported health insurance for everyone. So we knew then that we didn't have to create a moral or an ideological case for coverage. What we needed to do was create a business case and the kind of policy architecture for it. And so at that summit where the Blendon poll was released, on a stage like this, sat the 2 most powerful people in the private healthcare market, Jim Mongan, who was the CEO of then Partners Healthcare, and Bill Van Fossen, who was the CEO of Blue Cross. And the moderator, I don't think it was you, Martha, but it was someone like you, asked Jim, can a single state achieve universal coverage? Jim had worked in the Carter White House on healthcare policy, and he said, I think the answer is no, because it's tax policy, a single state can't do it, it has to be done at the federal level. Well, then Bill Van Fossen turned to him and said, you know, Jim, I think if everyone in this room, looking out at hundreds of people, could agree on the steps, we could accomplish it. And that gave birth to the Roadmap for Coverage, a project that laid out the policy choices. The second story I remember is that Nick Littlefield, who was the top staff and confidant of Senator Ted Kennedy, served on the foundation board, and he saw all the progress we were making in laying out the policy steps, and he said, we need to brief the senator on this. So we had a small dinner. John McDonough was there. Elaine Julian, who was then the CEO of Boston Medical Center, which the senator always wanted to protect, was there. And Nick said, Andrew, please explain to the senator the kind of approach we're taking. So I explained the combination of employer and individual responsibility and a state exchange and Medicaid expansion, which has not been discussed enough today, which was an important piece of it. And when he heard that, the senator kind of got a little angry. He said, I've heard this before. This has not worked before. We didn't work in Massachusetts in the late 80s. It didn't work with Hillary Clinton. I thought you were going to tell me something new. So, you know, that was a pretty intense response. And so I kind of mustered up my courage and I said, Senator, it is different this time. Let me tell you how it's different. It's different because we have both Republicans and Democrats interested in this. It's different because the business community, who had vociferously opposed the Dukakis plan in the late 80s, they're on board and supporting, and you'll hear more about that from Rick. And something in that moment he changed, and he said, tell me more. And we went through all the details of the plan, and at that moment he became the single most important advocate and ally for this effort. And so it was some of these small moments as well as the big moments which caused us to set ourselves on a path to universal coverage in Massachusetts.
Thank you, Andrew. Tim Murphy. So sorry. You were juggling a lot of financial pressures. You had the threat of that loss of federal funds, $385 million that somebody referenced a little while ago, and you'd also seen the calculations that showed this wouldn't be work. It wouldn't be affordable if insurance wasn't mandatory. So you and your boss, a Republican, framed the mandate as an individual taking personal responsibility. But I want to know, how did you get to yes on an individual mandate?
Good morning, everyone. Thank you, Martha. Let me kind of paint an image for you, kind of the room that you had to be in when that decision was made, because it was in the late spring of 2005. We knew the governor was going to make a speech at Andrew's event. We had been rolling out various concepts. So the exchange, which we call it now the connector, using, breaking down the uncompensated care pool, a number of breakthrough things that had to go in place, such that we go to a meeting with the governor, and we're down at an A&F, and there's about a dozen of us. And in that meeting, the governor, who I often say this when people ask me about what is it like to work for Mitt Romney, I said, I'd work for Mitt Romney every day. He is like best and most effective leader I've ever come across. And we sat down and we said, let's get ready for the big rollout. This is going to be the crescendo of what we're going to do. And my partner in crime, Brian Wheelan, and I, we ran the PowerPoint deck. And we're like, we're going to walk through and each component, boom, boom, boom. And then you get to the point where it's like, now let's talk about personal responsibility. And this is a big moment. It's a big moment because the idea itself would be transformative. It would be controversial. But the reason we could have that conversation was that we built in the law, the bill that we submitted, all the critical components to look at it and say, this is now a system that works. For those who need to be on Medicaid, as was mentioned, there is care for them. For those that are just cliffing off of Medicaid but not making quite enough money, there's an opportunity through a subsidy program for them to buy insurance through the connector. And for those that are trying to work through difficult cost choices in the private markets, we had a dysfunctional non-group market We had a small group market that needed improvements, and we did all of those things were in the bill. So therefore, it allows you to have then a conversation to say, is it fair then to ask individuals to take a form of personal responsibility? And in that, what we were trying to animate was, if we were going to allow the dollars to follow the people, we wanted to have a place where an individual person has to kind of lean in to the conversation. And there's lots of other kind of policy reasons why having an individual mandate makes sense. You referenced the econometric modeling. I can say that we were looking for more dynamic health insurance plans. And so in that room, it was one of these, if you're old enough, kind of a Capra-esque moment. If you're not quite as old, maybe a West Wing moment, where you had a lot of very serious people, those representing policy, finance, my good friend Tom Tremarco, the communications, the political folks, people like Cindy Gillespie and Beth Myers. And we went around the room and we talked about it and we debated it. Like, is this the step to take? And at the end of the day, there's a principal in the room. And the principal has to make the call. And the governor then asked us questions, and he made the determination. He closed the PowerPoint. He said, we're going to move forward with this. And so each of us had our own set of responsibilities. Cindy would go and work with the federal folks at Senator Kennedy's office. Beth and the team would make sure that they were talking to the folks they needed to talk to. And then it was up to Brian and I to bound down to our offices in the governor's office, and we had to make a phone call. We had to make a phone call to Andrew and Sarah Island because they were getting ready for their big event. And Andrew had a grid. It was, here are the proposals, here are the components. So these are your columns, these are your rows. And right down at the end was, is there going to be an individual requirement, a personal responsibility principle in this? And Brian and I were there. We went on the speakerphone. We called them up. And Andrew said, look, hey, I'm going to walk you down the list. Do you have this? Do you have this in your legislation? Do you have this in the legislation? And then he asked the question. And we paused, and then we said, you can put an X on that box. And as Andrew does, he took a beat, and in a very kind of subtle way said, oh, okay, this will be interesting. And that was kind of the decision-making, and that's where we got to with an individual mandate.
Love the stories. So many pivotal moments. Amazing. Okay, Rick. We're going to come back to you. No, actually, I'm going to go to Christine just for 1 second. We'll come right back to you. Hold on. Christine. Chrissy, you ready? It seemed that every time I saw you walking through the marble halls, you had stacks of folders in your arms. And you would be shuttling these competing proposals from one office to the next, trying to figure out, like, how are we going to negotiate this latest wrinkle? So was there a meeting when someone threw you a curveball and you said, oh, I really don't think I can catch this one? And what'd you do?
Thank you. Thank you, Martha. It's great to be here this morning. I have one, there were many moments like that, but I have one in particular, and it was very early on. We knew that there was an individual responsibility proposed, employer responsibility was over here. My job was to meet with the speaker and explain to him, you know, with all of my sort of policy baggage. So here's what happens if we do an individual mandate. Here are all the reasons why it's fraught. And then on the other hand, here's what happens if we do an employer mandate. Here's who's going to be upset with this. And he's sitting there looking at me like this. Didn't move, didn't say a word. And when I finished, he said, why wouldn't we just do both? Isn't that the most fair thing? And I mean, I'm not even sure what recommendation I was working up to give him. It was not that. I did stop breathing, I think, for a few seconds. And I looked at him, I thought, you know, I'm not going to bother responding with why it is so complicated for like political and policy reasons to even try that, because level of complexity meant nothing to him. It was the right thing to do. And I knew at that moment, from there forward, whatever we did was not going to be easy. It was going to be the right thing for as many people as possible. And that's probably the best story. And I have to say, I want to say thank you to Kezia and Marnie, because, you know, there's a lot of reasons why we did what we did, but you are who we did it for. So thank you.
Thank you. Okay, Rick. You had to take what was arguably going to be a very challenging argument out to the business community. You know, in many states, the idea of the employer mandate would have been a deal breaker, right? Just would have canned the whole thing. So how did you make the case? Maybe I should start with how did you get persuaded, unless you were on board right away?
I can't say I was on board right away, but Martha, I need to acknowledge two things that were really important to the business community at the time. One was that our political leaders really wanted the business community to support this effort. So I would thank Governor Romney and Senate President Travoliti and Speaker DeMacy. It was very important to them that the business community be at the table. And as Andrew mentioned, and this was interesting, in 1988, I was the Chief of Staff of the House Ways and Means Committee, helped pass the Dukakis era healthcare law, which did not have the support of the business community because it had a very big employer mandate. And the business community worked to basically repeal most of it when Governor Weld got into office. When I joined AIM in '91, I noticed on their legislative agenda, repealing the bill I helped pass was number one. So it was interesting to be on both sides. But secondly, what was important to the business community also were my colleagues at the time, you know, Paul Guzzi and Mike Widmer and Alan McDonald. Do
you want to wave your hands, Mike? Who else? Paul
and Alan. Is Alan out there?
Quick. Thank you.
You know, I couldn't have done it without them. They were at the negotiating table all the time with me and presented a solid front, so thank them. As far as an employer mandate, you know, we realized, because this was the theme of all the conversations, that it was going to be about shared responsibility. So we need to come up with something that made sense that our members could accept. I'll give a lot of credit to Mike Widmer for coming up with the $295, which was the fair share contribution early on. It represented the amount that our employers who were providing insurance paid into the uncompensated care pool for their employees. So it seemed like a fair thing that all employers, whether you provided it or not, should pay at least that amount. And so that was kind of the origin of the $295. But secondly, you know, we did also buy into the individual mandate concept, knowing that many of our employees who offered health insurance and had those young, healthy people who didn't take it, now we're going to be paying more because those people were going to be spurred on by the individual mandate sign up for their employer-sponsored health insurance. So there clearly was going to be a fairly significant employer responsibility in this bill. But you know what? We believed it was the right thing to do. We had the support of our members. We negotiated with the people we trusted that would do the right thing, and we ended up in a really good place, I think.
Yeah, amazing. Okay, question for all of you. Based on what you've described here and learned since all of these experiences, what advice do you have for policymakers, advocates, and industry leaders who are facing really tough healthcare challenges now? And if you could try to keep it to 1 minute. Andrew, do you want to start?
Yeah, I mean, I think Governor Healey said it, that, you know, the framers, if we can call them that, the framers of this law made a very explicit decision to postpone the discussion about cost and affordability. We thought about it, we talked about it, we debated it, and it was part of the reason the 1988 law failed, and we said, we'll do that later. And although, as you've heard today, we've had passed subsequent laws, we really haven't tackled that issue yet. And so we need to understand that the coverage that is so important to individuals relies on it being affordable. And the only way we're going to get to affordability if all the players, health systems and physicians and other clinicians and health plans and labor and employers and others come back to the table with the same spirit of shared responsibility. And so I urge the healthcare and business and larger community to do just that.
John, you're poised to jump in?
Okay. So I was Executive Director of Healthcare for All. In 2003, we created a massive coalition called Affordable Care Today. Shortly after that, we created a parallel coalition called, that was ACT, and then we created a parallel coalition called Affordable Care Act 2, or ACT 2. Act 2 would be pursuing a ballot initiative to go on the ballot in November 2006, unless the legislators came up with a meaningful, serious solution. The ACT coalition pursued the legislation. And in the summer of '94, Josh Greenberg from Children's Hospital said to me, hey, John, you know, there's this group called Greater Boston Interfaith Organization, GBIO. They've been doing affordable housing. They're looking for a new issue. Maybe you can pull them into the ACT coalition. So on Labor Day in 2004, I met Sherry Andes at GBIO's offices in...
Sherry, wave your hand. There she is.
We met in her at the GBIO offices in Upham's Corner, Dorchester, and I was head over heels in love right away in terms of coming in, and I was nervous that telling her, I'd have to tell her about the ballot initiative, and I was fearful that that would turn them off, and instead she said, you know, that's the most attractive part of it to us. And we collected 120,000 signatures. And I wish Speaker Mariani were here because we did it the old-fashioned way. Every single signature we collected was with volunteer labor. No paid signature gathering at all. And the last thing is, when we had the big legislative hearing in June of 2005, where we filled Gardner Auditorium with about 700 people, and GBIO filled about half the room. And all of the rabbis, ministers, all the clergy came in their full clerical regalia, the likes of which I think the State House had never quite seen before. And it made an impression on anyone, including people who didn't get anywhere near the hearing. And what it added to this effort was the moral voice. Was the sense of, yes, we got to deal with the finance, the legal, the federal, all of those different levels, and we had to keep first and foremost the sense that this is a moral imperative that we were engaged in here as much as we could, and that is a piece that I hope everybody keeps in mind.
Tim.
So, there's lots of issues that legislative leaders and executive branch need to grapple with. I would start with a quote that I always keep in mind anytime I'm taking on something big. It's by Margaret Mead. It's, never forget that a small group of committed, thoughtful citizens can change the world, because it's always been that way. And you start there. Second thing I would say is, if you're in the executive branch and the legislative branch, don't let John go and do direct democracy on you and have it through ballot initiatives, because you get really bad outcomes. They're not considered, they're not thoughtful, they're not into the technical details, and so I love advocates, and I think they play a really important role, but you have to do your job. You have to do your job. With regard to cost, you know these facts, but they're really important when it comes to healthcare. It's 20+% of the GDP. It's a fractured system. Even within this state, which is small, and we have small groups of providers or large groups of providers, it's not going to be solved by the government saying so. Otherwise, the benchmark would work. Doesn't work. It's a free market. You need to have the voices that Rick represented. You need to understand market dynamics. You need to understand there's a private sector. And I'm someone who dates myself back. My first job out of college, I worked for the Senate Ways and Means Committee for Pat McGovern. He was a terrific, terrific mentor to me. I did that for 3 years. I went to grad school. I was an investment banker. I came back to Massachusetts because I love the state. And Mitt Romney won. I said I could work for that guy. And what I would just say to you is someone who's kind of done a few kind of turns in and out in the last 20 years in the private sector, you've got to get out of your shell on Beacon Hill. You've got to go talk to the people who actually go and do the work every day and pay the bills every day and get those things done. And it's like you have to involve it because you're not going to solve cost. You're not going to solve cost just writing a piece of legislation. It doesn't work that way.
I think in retrospect, Martha, what I take away from this is that although the Chapter 58 was a wonderful accomplishment, and I'm proud that I was at the table, and we did provide access to virtually everybody in Massachusetts, that was kind of the easy part of that discussion. And, you know, we're back here 20 years later with the challenges that everybody's been talking about, of how expensive it is. I was telling Mike Caljo earlier this morning, I sit on a board of an organization that had a 24% increase in their health insurance premiums this year. That's not sustainable. And so we have to figure that out. And we've been kind of kicking that can down the road for a long time. So I don't have an answer. It's complicated. But the current system isn't sustainable, and that's the next challenge we all face.
Absolutely. Chris, close us out.
I'll pretend it's one lesson, but it's really 3 subparts of one lesson because Martha said we have to only have one. But first is how important, you've heard it from so many people, the trust relationship. And the corollary to the scenario with me talking to Sal about what's the 2 mandates. Very soon after that, it was time for him to meet for the first time Reverend Hamilton and Rabbi Pesner. And first time, he'd never met. They walked into his office. He sat down and he said, I want you to know that I'm going to support both an individual and employer responsibility. And I'll paraphrase. They weren't jumping up and down. They said, Mr. Speaker, I'm not sure we can support an individual mandate. I'm paraphrasing. And the Speaker said, trust me. Trust me. I will not let one be in without the other. And they said, we're going to trust you. That's more than half the battle. I will say, you know, we've talked a lot about quotes today. There was, you know, Time Magazine used to have this quote of the week. And on April 17, 2006, there were quotes from Mayor Rudy Giuliani, U.S. Senator Patty Murray, Saddam Hussein. In the middle was Salvatore De Masi. His quote was, do we know whether this is perfect? No, because it's never been done before. We don't only do hard things, we do things that have never been done before. And the challenges that we're facing today are going to require probably doing things we haven't done before. It's that moment of Chapter 58 that was a big moment, but it was a moment that moved forward the movement in Massachusetts forward and upward to do things that have never been done before to make people's lives better. I think that's, it's a huge lesson. One last piece of this is we can build it. We can build new paths to coverage. We can build new products, insurance products. We can build an entire marketplace, statewide marketplace for purchasing health insurance. But they will not come if they don't know that it's available, they don't know they're eligible, they don't know how to sign up. The investment that we've made over and over in knocking on doors, going to congregations, is wherever people gather, is what really made this work in implementation. So that's the last huge lesson.
Thank you all so much. Thank you. You want to quiet everybody down? Hey, we have a really important moment coming up. Just please take your seats. You're not going to want to miss this, and you're going to want to be seated. Thank you. Hi, everybody. As all of us know, many people have contributed to the success of Chapter 58. Sadly, some of those people have died over the last 20 years, but we wanted to remember them today. So I am going to read a list of names and the roles that these people played in Chapter 58. And then Pastor Hamilton is going to offer a prayer of gratitude and remembrance. We suspect that our list of people is incomplete, so we ask you to hold in your hearts anyone else who worked on Chapter 58 who's no longer with us. Nani Burns, who was the Commissioner of Insurance during the early days of Chapter 58. Jack Connors, a legendary business leader and philanthropist who supported Chapter 58 and worked to bring the business community together in support of the law. Norman Hahn, who was the Director of Healthcare Policy for the House Ways and Means Committee during Chapter 58. Representative Bob Hargraves, who's been mentioned already this morning. Representative Hargraves was a longtime member of the House of Representatives. He worked closely on healthcare reform, including, as we heard from Speaker DeMacy, was a member of the conference committee. Andy Hyman. Andy was a senior program officer at the Robert Wood Johnson Foundation, who funded Community Catalyst and many other consumer groups across the entire country to work on expanding coverage. Chip Jaffe Halpern. Chip was the executive director of EcuHealth, chair of the board of Healthcare for All, and he was the first consumer member of the Health Connector board. Phil Johnston, former Secretary of Human Services during Governor Dukakis's administration, a longtime chair of the board of the Blue Cross and Blue Shield of Massachusetts Foundation. Senator Ted Kennedy, who's been mentioned so many times already this morning, the Lion of the Senate, where he represented Massachusetts for nearly 50 years and was critical in so many ways to expanding coverage in our state and around the country, including playing a really critical role in securing the federal funding for Chapter 58. Nick Littlefield. Nick worked for Senator Kennedy as the staff director of the Senate Committee on Health, Human Resources and Labor, and he was a passionate board member of the Blue Cross and Blue Shield of Massachusetts Foundation for many years. Dr. Jim Mongan. Dr. Mongan was CEO of what was then Partners Healthcare, where he was a champion there and in previous positions of expanding coverage, and a big supporter of Chapter 58. Kate Nordahl. Kate was the Director of Policy and Research for the Blue Cross and Blue Shield Foundation, and then she served as Assistant Commissioner at the Division of Healthcare Finance and Policy during the early years of the implementation of Chapter 58, and then she went on to be the head of the Massachusetts Medicaid Policy Institute. Dick Powers. Dick was the Communications Director for the Health Connector during the early days of Chapter 58. Rob Rastusha. Rob was the founding executive director of Healthcare for All, and then the founding executive director of Community Catalyst. In all of those roles, he was a tireless advocate for expanding coverage, very important during the passage and implementation of Chapter 58 and the Affordable Care Act. Stacey Sachs. Stacey was the health counsel for the Senate Help Committee, a key staffer for many years to Senator Kennedy, and played a very important role in Chapter 58 in the Affordable Care Act. And Tom Stemberg, business leader and founder of Staples. As we heard earlier from Governor Romney, he attributes, at least in part of his focus while he was governor on an early conversation he had with Tom, who encouraged him to work on expanding coverage. So, Reverend Hamilton.
Thank you. Would you stand, please? We will participate in this prayer together. When you hear me say, "Let the people say," your response will be, "Thank you, God." Let's practice. Let the people say, "Thank you, God." God of creation, in our Christian scriptures, we read these words, "Now that we are surrounded by such a great cloud of witnesses, let us run." We pause in this moment to remember those who are now a part of that great cloud of witnesses. We do so with hearts filled with gratitude. Let the people say. Some were people of power and position, their names known, their legacies secured in public service, such as the names that Nancy have just listed off. We say thank you. Let the people say. Others sat in offices as staffers, clerks, executive assistants, who generated the papers and produced the work and helped to shape policy, often invisibly. That which we now celebrate as Chapter 58, their fingerprints are there. For them we give you thanks, let the people say. Others were among the foot soldiers, whose names never appeared in newspapers, never highlighted on NPR or local TV, but they were the real everyday people for whom the law were passed. They prayed, labored, collected signatures, shared their stories, testified at hearings. They met with lawmakers and public officials. They gathered to form crowds of power in holy places of worship, Jewish and Muslim and Christian. And they gathered in the halls of politics to transform those spaces into holy rooms of action and hope for the masses, such as the late Peter Brooks. Let the people say. Oh, how we thank you, God, for this great cloud of witnesses, without whom we would not be gathered here today. And today we pledge afresh that we'll keep running, we'll keep working, we'll keep praying, we'll keep believing, and for the opportunity to do this great work, no matter how challenging, for the gift to run this race, to fight these battles, to press on with the faith that the arc of the moral universe is long, but it does bend towards justice. Let the people say, amen.
Thank you so much, Nancy and Pastor Hamilton. Ken, Anna, and Sheena, can I ask you to head towards the stage? Thank you. So I think all of the folks that we were just reflecting on would be so pleased now to hear about more ways the mass health coverage law is making a difference in people's lives. Excuse me. Ken Moore is a navigator at Mannett Community Health Center. He's joined by Sheena Adams and Anna Martone, who get health insurance through the connector. Ken?
Thank you. Thank you so
Good morning, Governor Healey, Governor Patrick, Governor Romney, elected officials, and everyone here today. It's an honor to speak to you today. As we celebrate the 20th anniversary of Chapter 58, we are not just recognizing a landmark piece of legislation, we are celebrating a commitment to making healthcare accessible, affordable, and within reach for every resident of Massachusetts. My name is Ken Moore, and I have worked at Manic Community Health Center as a patient navigator for 26 years. Thank you. Thank you. I remember helping people 26 years ago, before Chapter 58, and many felt confused, overwhelmed, and even embarrassed to ask for help with health insurance. They wondered if affordable, quality health insurance was even possible for them. As a navigator, I've seen the enduring impact of Chapter 58 every single day. I work with individuals and families who are trying to understand their options, enroll in coverage, and access the care that they need. But this work is about more than health insurance. It's about trust, it's about their dignity, and it's about peace of mind. Over my 26 years, I have had the privilege of seeing many full circle moments. I have helped individuals when they were young and uninsured enroll into Health Connector plans. Then later helped them as parents enroll their children into coverage. And now I help their children as they begin navigating health insurance themselves. Thank you to you all, past and present leaders, for your vision and commitment. And thank you for recognizing that health care is not just a policy issue, but a human one. I am here on stage today with Sheena Adams and Anna Martin, two people who have experienced the benefits of health coverage and will now tell you their stories. Thank you.
Hi everyone, my name is Sheena. I'd like to thank everyone involved and for inviting me here today to tell my story about how the Health Connector has helped me in my ongoing health diagnoses. Over the last few years, I've not only needed health insurance, I've needed to use it. At every step, I've been able to take care of some important health matters, and I have not worried about the care that I've needed. In 2022, I was experiencing a lot of unexplained pain, and I ended up getting diagnosed with a rare and chronic condition, interstitial cystitis. In 2024, I had to have emergency gallbladder surgery. In 2025, I was expecting my first child, a beautiful baby girl. With that came a lot of monitoring and prenatal care. If I didn't have the Health Connector, which allowed me to have affordable health care in place, I would not be able to stand on the stage today while living my healthiest lifestyle. Having affordable health insurance has made it so I can focus on my health without the financial burden. And for that, I can't say thank you enough to the Health Connector and to all of you involved for the past 20 years and for all the years moving forward. Thank you.
Good morning, afternoon actually. My name is Anna Martone, and thank you for giving me this chance to speak with you all today. We have several milestone birthdays as we become adults. 16 to drive, 18 to vote, 21 to drink, and 26 to go, oh no, I need to think about health insurance. It is a lot for a 26-year stressful to handle. Frankly, health insurance right now is a lot for anyone to handle, which I see often as a pharmacy technician doing medication prior authorizations. I was one of those 26-year-olds that didn't figure it out. For a month, I was without several medications and unable to keep some appointments as I could not afford them without my insurance. I realized in a way I was very lucky that I had these medications as an early warning sign, as within the first month I had to scramble for coverage. It terrifies me now that if I took no medications, I could have potentially been unaware until I needed an ER visit. My coverage over the last 10 years got me through an unexpected surgery and an autoimmune disease diagnosis and allows me to get expensive treatment that keeps me healthy. For the reform that has been life-changing and life-saving for me and allows me not to worry day to day about how I will afford my health, I thank all who made it happen.
Thank you all so much. All right, we have our final panel. Oh, good job, guys. Racing up to the stage. This is about how the law actually took shape with some somewhat unlikely allies and members coming together again. And we're going to glean some wisdom from the people now walking onto the stage who had to deliver on that promise of near universal health coverage. So, Tom Diener is way down there on the far, hey. Tom was the Assistant Secretary for Mass Health at the time, and Sarah is next to him. Sarah was as was mentioned earlier, the Commissioner for the Division of Healthcare Finance and Policy. We have John Gruber next to Sarah, the resident health economist on the very first Health Connector board. John Kingsdale was the first executive director of the Connector Board. And finally, you've already heard from Pastor Hamilton, who was then the president of the Greater Boston Interfaith Organization. Sarah, I'm going to start with you. So, Chapter 58 left quite a lot of decisions and policy machinations to regulators. You had to impose that new mandate and some new sometimes much stricter health insurance requirements on employers without provoking a backlash that might undo everything. So how'd you do that?
Thank you. This one was particularly tricky, Martha, because in spite of our all coming together in this kind of grand bargain that we made around shared responsibility, there were some aspects of the law on which we weren't totally aligned. So the employer responsibility provision was actually one that Governor Romney vetoed. The legislature overrode, but before Governor Romney left office, he issued a regulation that when Governor Patrick took office, decided that in this balancing act that this law was, and Nancy Turnbull at one point described it as an Alexander Calder mobile, that could stay balanced even in high winds, she was reminding me this morning. The Patrick administration's conclusion was that the regulation that had been issued was not actually consistent with the weight that the employer responsibility provision was meant to carry. And so to your point, that was very tricky to navigate because it was our intention to actually tighten it up, to be more aligned with the compromise that was made with the business community. And so they've been mentioned before, but I have to give a huge nod both to Kate Nordell, who is my partner in this work, and to the leaders of the 4 major business organizations, Paul Guzzi, Rick Lord, Mike Widmer, and Alan McDonald, for having endless meetings with us in which we looked at the data, we pored over it together, and then came up with, I think, kind of an elegant and beautiful solution, which was to switch. There were 2 criteria employers, or one of 2 that employers could meet to not have to pay the fair share. It was either to offer about 1/3 toward the cost of premiums in the insurance coverage that they were offering, or to have 1/4 of their employees take up that coverage. It did not apply to the smallest employers. And where we landed was switching the or for the largest employers who had 50 or more employees to an and. But the number of hours, the depth of collaboration, the goodwill, and the trust that it took to get there so that we could issue a new regulation without having this all blow up was quite a feat, and really a testament to the leadership and commitment of this community.
Thank you, Sarah. John Gruber. The individual mandate was a big new experiment that the Connector board members had to make acceptable and affordable with some decent coverage. So you knew what would work on paper, but you had to debate and vote in rooms filled with people holding signs or holding prayer vigils in hallways. That's your... That's me. Yeah. So could you take us to one of those decisions? Is there one that stands out in your memory?
Yeah, Martha, I think I want to start by recognizing something I think has not been recognized quite enough today, which is the brilliance of the legislature in passing a law with some pretty big uncrossed T's and pretty big undotted I's.
Okay.
Okay, and the willingness, the reason that was brilliant was A, it allowed them to pass this ambitious law without getting too caught up in the details, and B, to leave those decisions to an expert board that could take the time to get it right. Now, I'm kind of nostalgic for the days when expert was a word that people liked. But the point was the board did the legislature did a fantastic job. We had an incredible executive director, John Kingsdale. We had representatives from the labor community, insurance, business, and others that really made that work out. You know, the great Dolores Mitchell, who head of GAC and longtime board member, said to me that she kind of thought this was like 10 people who didn't know each other.
You just raise your hand, Dolores.
Yeah, Dolores.
Come on.
She said to me, this is like 10 people who didn't know each other getting on a bus. We all knew where we were going, but we had no idea how we were going to get there. And it was an incredible experience, and one of the hardest decisions we had to make was how do we implement the individual mandate? Let's emphasize how radical this was. Okay, this was an academic exercise popularized by a conservative think tank that had opponents on the right and especially on the left. And yet, it came together to be passed because of the courageous leadership of the governor, the incredible work of the legislature, and I want to call out John McDonough, because it was people who'd been longtime advocates who'd held very strong positions, who were willing to be flexible because they had the same goal, which was to get universal coverage for the state of Massachusetts. And that was key in making this happen. And we had to face two important decisions. The first was, one of the big uncrossed T's was this mandate only applied when insurance is affordable. Well, here's a dirty secret I'll share with you all. Affordable has no meaning in economics. Okay? Affordable is a feeling, not a measurement. So how do you turn a feeling into a law, into a rule? That was our first challenge. The second challenge was another undotted I, was there should be a minimum essential benefits package, but it was not defined what that should be. Now, no state had ever tackled this problem before, of what should be the standards for what insurance should be for the entire population. And that involved key trade-off, which is you want insurance to be comprehensive enough to cover people and give health, but you also want it to be affordable. And the more benefits you added, the more expensive it got. So we faced these two decisions. How did we solve them? We importantly invoked two principles. The first was data and evidence. I work with teams of MIT students to think about what made insurance affordable. John Kingsdale and the wonderful Connector staff brought forth data on what insurance packages look like and how we could design it. The second was stakeholders. And here, Nancy Turnbull, the incredible leader of Blue Cross Blue Shield Foundation at that time and later Connector board member, convened critical stakeholder meetings at which Reverend Hamilton was a key participant, where we debated the pros and cons of different ways of approaching this. We put those two things together in a way which allowed us to solve the problem in a way that got broad buy-in. And we did it. We ended up with an affordability standard that allowed virtually everyone in Massachusetts to afford insurance, and a benefits package that, along with the subsidies under the Connector, allowed everyone to meet that affordability standard. And that is because of those two things working together. You know, it was a long bus ride. I think there's moments in which all of us got quite sick. Some of us fell off the bus. But at the end of the day, I think it was a bus ride that led to a very, very good place, and I'm really proud to be part of it.
Thank you, John. John Kingsdale. You were in charge of building, you have to pick up your mic now. Thank you. You were in charge of building the Connector, this new agency where people would buy subsidized and unsubsidized health insurance. So you were essentially running a startup with tight deadlines and lots of public scrutiny. Tell us about a mistake and a win.
Well, first, thank you, Martha, for doing such a great job emceeing this. And Audrey, what a thrill to see somebody who was an intern in our office 20 years ago, such a mistress of ceremonies, and to all the political leaders who actually made this happen. So the mistake and the win is one story that I'm going to tell you. There are many mistakes, but I'm going to pick one where the headline was, picking right up on John's talk, unaffordable insurance, and how we turned that into a win. So let me give you a little context. In November 2006, we had just started a little bit of the programs, and the Connector was charged, all sort of 10 of us, to be the mouthpiece for health reform in the state. We went on to have 200 meetings across the state. We had a whole campaign with the Red Sox. We had celebrations of every milestone we could imagine. We were cheerleading health reform. And one of the big challenges was when we went out to bid at the end of 2006 for the first set of unsubsidized health insurance plans. We got 10 different companies that bid, which was great. And if you think about how health insurance is priced, we literally got hundreds of prices. So the price varied by where you live, by your age, by the health insurance plan, by the benefit level, bronze, silver, gold, etc. And we had to disclose this, in effect, to the public through a committee meeting of the board. We would have it in a little conference room where all the advocates and the press, and you were probably there, Martha, were jammed in trying to listen. And frankly, we didn't do a good job of figuring out how to frame this. I mean, the bids ranged from like $200 to $500, and we kind of described that and kind of like tried to get the meeting over so we could start doing our work. And the actuary on the board, who after all was not a resident of Massachusetts and not particularly plugged into Massachusetts politics, said, oh, so the average is about $380 a month. Well, it was like somebody slicing a feather pillow in half. There's no way to put that back in the bag. The Romney administration had promised that you could buy health insurance for $200 a month. And the headline, sure enough, above the fold, the next morning in the Boston Globe was, health insurance, $380 a month, unaffordable. Okay, so the governor's been in office about 4 weeks. The new chairwoman of the board, Secretary Leslie Kerwin, I don't know, is Leslie here? She did a great job leading that organization. Anyway, I guess not. She had been in office about 2 weeks. We had zero working relationship, and we're, Saturday morning after this board meeting, trying to crisis manage. And so we had a press conference Monday morning, the governor, Leslie, and myself, all singing off the same hymnal, which was unaffordable. So insurers, go back to the drawing board, sharpen your pencils, and come back with rebids.
That's great.
Now, I'm going to get to the punchline.
Okay.
I know health insurance. I'd worked in it for 30 years. I knew there might be 3 to 5% fat. There's no way we were getting from 380 to 200. And sure enough, the rebids came in somewhere between 2 and 5% below the original. But what we did was we framed this with the typical end user, the consumer in mind, who would be a 37-year-old resident of Boston. And for that person, there was a bronze plan for $175 a month. We would put out the press release. The governor congratulated the insurers. The Senate president congratulated them. I congratulated Speaker DeMacy, congratulated them. And that was the headline. And voila, health reform was back on track.
Threading the needle. There you go. Tom? Hello, Mr. Diener. How are you? So the law expanded access to mass health for lots of people. They hadn't qualified for coverage before. But there were still a lot of debates about who should actually be covered, like what the state could actually do. Can you tell us about maybe one of the dynamics that you had to manage and how you did that?
Yeah. There was kind of a pure Medicaid expansion, as Andrew mentioned. There was a pure Medicaid expansion in this law, kind of a real one. It's mostly children. But that was a big part of the coverage gains. And then there was this, we don't want to say impure, but another expansion, Commonwealth Care, this subsidized program that we were creating. So we had to integrate that. To get into Commonwealth Care, you needed to be ineligible for Medicaid, and we had to integrate that eligibility system. And we didn't have, 3 years to do it like they did under the Affordable Care Act. We had, 3 to 6 months to do it. So you had Mass Health with the kind of system, and you had the connector, kind of brand new outfit, ready to roll. And I would like to say that it was collaborative, but in a real way. We were like on different sides of this situation. I see Rosemarie Day out there. She and I, literally negotiated a contract between Mass Health. Hey, Rosemarie, the operational powerhouse of the connector. We had a contract. We were sitting across the table, and it was very hard. So here's what it was like. So somebody puts together some notices. There's new notices. These are the Commonwealth Care notices. Here they are. And so this notice says, "Dear so-and-so, you have been determined ineligible for Mass Health Standard. You have been determined ineligible for Mass Health Family Assistance." Then some gibberish about, appeal rights, and then way down at the bottom, "You have been determined eligible for Commonwealth Care." And we're like, here they are. And somebody at the connector looks and they're like, "Oh my God, no!" It just didn't make sense to the connector. John's like, "This is not a Medicaid program, it's a commercial program." And I'm like, "Yes, it is Medicaid." But there were just a million things like that that we're battling about. Logos, somebody's come in my office, "Tom, they're battling, they're complaining about the fonts." So it was just constant. And so, I don't know, I think that to answer your question, Martha, it was tense is how it was. It was extremely tense. And it was like a clash of kind of cultures in a real way. So I think everybody knows that the Mass Health is the operational backbone. I just want to say one other thing, because as John mentioned, there was kind of a policy backbone pre-existing at Mass Health and at the agency. We already had a waiver. We already had a big nationally known Medicaid expansion because of a law written by John McDonough and Mark Montigny. And we had a team of people that knew how to get an 1115 waiver done, that knew that could listen to Ron Preston's vision, and could have Tim and Brian come in like a firestorm, figuring everything out, but could tell them, I just need to name, Beth Waldman, Stephanie Anthony are both here, many other people, but that kind of infrastructure, that sort of people infrastructure, was also kind of totally fundamental. Both the systems and the people kind of were where this whole thing started.
Thank you, Tom. Okay, Pastor Hamilton, you and GBIO were holding the rallies with everyone in their regalia. I think there was incense, if I remember correctly, too. You were holding 101 insurance meetings in church basements. Give us one example of a vote that GBIO mobilized to influence and your tactics.
Thanks, Martha. First, just before I do that, I want to just call out a couple of names, because I represent an incredible team of leaders. Some of them are here. I call your name. Would you just stand real quickly? Rabbi Jonah Pesner, and Nancy Kaufman, and Naomi Natick, and Fran Godine, and Paul Hadis, Pastor Ray Hammond, Pastor Burns Stanfield, Kiki Duke-Hassan, our organizers, Sherry Dees, Ani Graff, Larry Gordon, and the one who helped to get GBIO kicked off, Lou Finford. Would you just give them a wonderful round of applause? These are the people that I represent up here. Now, I've got a really good story for you, but let me just give you the context real quickly in preacher style. You will recall, leading up to Chapter 58, as you already pointed out, that GBIO was heavily in the organizing business. We generated through our institutions hundreds of folk who helped to collect over 50,000, 55,000 of the signatures that were collected. We filled the hearing halls with leaders who told their stories. We had multiple actions of over 1,000 people really driving the momentum behind this effort. Ultimately, we partnered with Speaker DeMacy and was excited to get Chapter 58 over the finish line. So I think we're at Healthcare for All headquarters, and maybe a day or two after, we're celebrating. The champagne is flowing, the 7-Up is flowing, and we're slapping hands, excited. Sherry Andes, our lead organizer, comes and pulls me and Rabbi Pessner and a couple other people. Paul had us to the side and says, listen, put your glass down, we got to go back to work. And I hadn't even finished drinking my 7-Up yet. And here's the point she made. She said, listen, she says, the law does not say that everybody has to have health care. The law says that everybody, that if there is an affordable, credible product available, then you have to have health care. So between April and September, which is the timeline, 3 questions are going to have to be answered. 1, how do we define affordability? 2, what's credible? 3, who gets to decide? And so we decided right then that we wanted real people in those rooms making those decisions that was going to impact their lives. So we came up with this just wonderful concept called affordability workshops. We had 50 of them. Can everybody say 50? 50 of them across the greater Boston area, generated through our institutions, about 640 participants. And essentially what we asked those participants to do was to fill out a worksheet. How much, what's your income for each month? What's your expenditures for each month? How much do you have left over to pay for health care? Of course, zero. As a matter of fact, we discovered that most people were putting their health care and rent and food on credit cards. So that gave us the ammunition, if you will, to engage in the battle. We took a position that said that we were going to argue before the connector that everyone up to 300% of poverty should get 0 premiums. Now, my good friend, Mr. Jonathan Gerber over here, took a different position. He essentially said that if the data demonstrates that there's a group of people who are already paying health care, that's the affordability point. Now, of course, what we said to Mr. Johnson was those folks are putting health care on their credit cards. And so op-eds went back and forth. We talked to NPR, we back and forth. Ultimately, we reached a wonderful conclusion through the connector, which was something we were celebrating. Up to 100% of poverty, 0 premiums, between 100% to 300%, a really aggressive sliding scale. That was an incredible compromise. It demonstrates how politics should be done, can be done, and how at the end of the day, real people can make a real difference.
Pastors and the rabbis against you, that's for sure. But that guidance aside, for each of you, again, we're looking for some guidance here. Like, we're in trying times. So what advice, based on your experience then, or all the amazing work you've done since then, do you have for the rest of us out here wondering how are we going to navigate the challenges facing Massachusetts today? Who wants to start? Sarah?
I'm happy to. We have a lot of challenges facing us today, and a lot in healthcare in particular. And I think one of the lessons from this 20-year anniversary is we didn't try to solve everything. We got very focused. And I think we are in a moment right now, because of the loss of federal funding, when the issue that we need to focus on next is really the underlying cost of healthcare. And I think the other big lesson is we can do hard things. We've seen it, we've kept it going, we've learned, we've adapted. And while I think this is a harder challenge, it's a harder nut to crack, because anytime you talk about costs, you're talking about someone's revenue. And you're talking about either constraining the growth in their revenue, or you're talking about taking revenue away. It is a more complex challenge. That's why we decided to tackle coverage first. But they are so inextricably linked. I think we are in a moment where we have to get really focused on healthcare costs. There's nowhere I'd rather be doing that work than here, for all the reasons that we've heard all day today. The fact that it's a small enough community, we can all fit in this room. We know each other. There's so much trust and goodwill. But we've got to get after it and recognize that it's going to be harder work ahead.
Thank you, sir. I'm going to ask everyone to be equally concise and keep it to 1 minute. Sorry, I forgot to say that. Tom?
Yeah, Martha, I'm the appointed Medicaid-focused person here on this panel at the end of this day, so I'll just say about the future that it seems to me that that public program and the health safety net together undergird this expansion. All of this, no offense anybody, fancy talk about the affordability standards and this broader picture, all of that is undergirded by this kind of support for the safety net through Medicaid and the health safety net. And both of those things are under very direct threat right now in terms of Medicaid eligibility based on new federal requirements, which we need to find a way to kind of like manage by playing defense. And the health safety net is also just not, it is still needed even though we have universal coverage, because it finances primarily coverage for people with immigration statuses that don't allow them to be covered under this reform. That problem is only going to get extremely worse. So I am only saying what everyone already knows, but I do think that it is going to require a return to kind of like the values of this whole program. And it might not include a return to only stuff that we get federal financing for. So I kind of think that we're at a time where the state is going to have to decide whether it's going to step up, irrespective of what the federal government's going to do.
John Kinsdale?
Yeah,
John
I would
Gruber.
just make,
Great, thanks.
what?
Pardon me for interrupting.
I would just make 3 quick points, Martha. First of all, if there's any lesson I have today, it's be ambitious. Set a goal, set an ambitious goal, be ambitious. The second lesson is only set standards to meet that goal which are real accomplishments, not vague standards. But things like defining affordability, defining minimum credible coverage. Accept those real challenges, okay? And the third thing is be relentlessly optimistic. This law is a testament to the power of positive thinking, if nothing else, okay? And if we're gonna set those ambitious goals, try to meet them, we have to just learn from the lesson in Massachusetts that this can be done and we can't give up just because it's hard.
Thank you.
Well, I'm just a guy who was selling health insurance, so I'm not sure I should give advice to anybody. But I was involved in implementing the ACA as well, and the contrast implementing Chapter 58 and the Affordable Care Act could not be more stark. And the difference was that we had, because of the work of Andrew and John McDonough and Rick Lord and the legislative and gubernatorial leaders, we had tremendous public support. Our job was just to ride the wave and not fall off. And we can tackle the threats to immigrant health, We can tackle the bureaucratic obstacles, work requirements to Medicaid eligibility. Heck, if we all wanted to, we could even tackle costs. But let's leave that one aside because that's really tough. We can do this if we have private and public sector leaders who make the case and build support and consensus for actually doing and not being done to by this federal administration.
Thank you. Pastor Hamilton.
I think what I would say is to not allow the current socio-political atmosphere of cynicism and toxicity to make us cynical and toxic. And one of the remarkable miracles, if not the miracle, I think, of chapter 58, is that at the end of the day, it was achieved by Christians, Jews, Muslims, Republicans, and Democrats, business, and a wide variety of healthcare interests, et cetera, et cetera. People with power, people who didn't know they had power, certainly discovered it. And in GBIO, we had a kind of a value. We said, no permanent allies and no permanent foes. Today, it's very challenging for us to lock in on permanent foes. But I just want to remind you, what made this work was that we realized that beneath all of our different interests was shared stories. We all knew people who healthcare saved and preserved their lives, and so we had a common interest. And so I just want to say that the current context, a lot of fear, a lot of pain is being manipulated and played upon. Don't get locked into this notion of public permanent foes. Let's get to hear the stories and the pain and the fears of those that we often disagree with. Therein lies the opportunity to build new alliances, to discover new miracles like chapter 58. It may take a while. The arc of the universe is long, and it does bend towards justice.
That was perfect. Thank you so much. We have our keynote speaker coming to the stage now, who I just had the pleasure of meeting in the green room. Come on up. Folks, thank you very much. Yeah. See you on the other side.
Yes, mine.
Okay. Hey there. Shakita Brooks, LaSure, thank you, is among those who think that the guidance we just heard from, coming from Massachusetts, could help Massachusetts lead again. She ran the Centers for Medicare and Medicaid Services in the Biden administration and has been involved in national health care policy for more than 2 decades. Welcome.
Thank you. It has been so inspiring and truly powerful to hear the stories of how you all came together to change the lives of the people of Massachusetts. I want to take a moment to describe how Massachusetts paved the way for the nation. And I don't say that as a polite compliment. I say that as someone who was in the room when it happened. I was a staffer in the House Ways and Means Committee during the years leading up to the Affordable Care Act. I lived that debate from the inside, the negotiations, the setbacks, and the moments when it felt like the whole effort might collapse. And I can tell you with certainty, what Massachusetts did here in 2006 made the ACA possible. It did so in 2 distinct and essential ways. First, it gave us a framework. Before Massachusetts, the national conversation about health reform was a collection of competing ideas with no common starting point. There were dozens of proposals, and the gap between them felt impossible to bridge. What Massachusetts provided was proof of concept, a real functioning model that the Obama administration, the House, and the Senate could actually build from. You gave Washington a common starting point. That is not a small thing. In policy, a working model is worth 1,000 white papers. Second, and perhaps more importantly, Massachusetts proved that difficult things are possible. By 2009, the country had witnessed decades of failed attempts at national health reform. The graveyard of good intentions was long. People were skeptical. There were significant lawmakers, advocates, policy experts who genuinely believed that meaningful national health reform simply could not be done. And then there were moments, and there were many of them, when the ACA debate appeared to be over, when the votes were not there, when the politics had turned, when the whole effort seemed like it was going to join every previous attempt in that graveyard. And in that moment, Massachusetts was the answer to the question, is this even possible? And the answer, because of what you had done, was yes. And it's hard to overstate how important that was. Hope grounded in evidence is a powerful thing. 16 years after the passage of the ACA, the American healthcare system is meaningfully better. And I want to be clear about that because it gets sometimes lost in the ongoing battles over the law. Despite multiple repeal efforts, despite relentless political attacks, the core protections of the ACA have endured because they worked and because the American people have come to rely on them. People with pre-existing conditions can no longer be charged more for coverage or denied it altogether. There are no more lifetime limits that leave families financially devastated at their most vulnerable moments. Women are no longer charged more because of our gender. These protections, which were not the law of the land in 2009, are now woven into our collective understanding of what healthcare coverage should mean. The vast majority of Americans across party lines believe that these protections should exist. That is a durable achievement, and it traces back directly to what you started here. I am also tremendously proud of what we were able to accomplish during my tenure as administrator of the Centers for Medicare and Medicaid Services. Under the Biden administration, we reached the lowest uninsured rate in our nation's history. We doubled the number of people covered under the ACA marketplace plans, from 12 million to 24 million Americans. We strengthened Medicaid, not just by expanding enrollment, but by improving access to care, prioritizing maternal and behavioral health, and working to ensure that coverage is not just a card in your wallet, but a genuine path to the care that you need at a price you can afford. All of this is part of Massachusetts' legacy. This state set something in motion 20 years ago that is still reverberating. And now we find ourselves at a similar moment in history, one where states must again lead. The challenges facing our healthcare system today are serious and in many ways more complex than what we faced in 2006 or 2009 and 10. Too many people, whether or not they have insurance, struggle to afford their medical costs. Premiums, deductibles, and out-of-pocket costs have reached levels that cause people to delay or forego care that they need. And while we still have an important work to do to ensure that every American has coverage, we must confront the underlying cost of care itself, because coverage without affordability is an incomplete solution. These costs are unsustainable for individuals and families. They are unsustainable for small employers trying to offer benefits and compete for talent. And they are unsustainable for states managing Medicaid budgets under increasing fiscal pressure from the federal government. And they are also unsustainable for the federal government. And increasingly, most stakeholders across the healthcare system, doctors, nurses, hospitals, insurers, pharmaceutical companies, also believe that the status quo must change for Americans to get the care that they need and deserve. We are facing a truly difficult moment again.
But this is what I have seen from 25 years in health policy. Difficult moments create openings. The urgency that comes from a system under real strain has a way of making previously impossible conversations possible. It creates the conditions for the kind of coalition building that brought you all in this room today. Because here is the truth. Challenges of this scale and complexity cannot be solved by any one sector alone. It is only when the voices come from across the spectrum, the ones that have been talking and are here today, public and private, nonprofit and industry, faith-based leaders, the executive branch and the legislature come together to design solutions that we have any real chance of getting this right. I know that you here in Massachusetts are up to this moment. Just as your work over the past 2 decades to control costs has inspired efforts in states across the country, I am confident that what you are building here under the direction of Governor Healey, bringing together a diverse coalition of leaders grounded in evidence and committed to real solutions, will once again serve as a model for this nation. The rest of the country is watching, and based on your history, they should be. We know that the path forward will not be easy. It never has been. But you have done hard things before, and the results have mattered, not just for the people of Massachusetts, but for tens of millions of Americans who may not even know that what protects them today began right here. Thank you for the work you are doing. Thank you for your leadership. And thank you for once again showing the country what is possible.
Thank you, Shakita. The gentleman walking on to the stage led many rallies in churches and synagogues 20 plus years ago. As part of GBIO, as you've already heard, Rabbi Jonah Pesner is now, is he the director, right?
Yes, but
Of the, why
that's
not?
not important now. Everybody wants to go have lunch.
I know, but I'm going to say Religious Action Center for Reform Judaism. Hello, Jonah.
Thank you, Martha. Okay. Good evening. I want to invite my pastor colleagues, Ray Hammond and Bern Stanfield and Pastor Hamilton, to join me on the stage, and all of my GBO friends, and then everybody stand together to celebrate Zeh Hayom Asa Adonai Nagila V'Nismecha Bo. This is a day that God has given. We are rejoicing. We are celebrating 20 years of affordable, quality access to health care. I'll never forget when we asked Governor Romney, do you as a man of faith believe that every person is B'Tselem Elohim, created in God's image? And he said yes, and we said, will you then champion with us and the hundreds of thousands of our grassroots pastors and rabbis and imams and civic leaders who joined together to fight for quality, affordable care? And so how fitting that the last moment of blessing is the grassroots leaders, the people of faith like you who stuck with us till the end. So celebrate all of you. Because here's the news. This prayer is actually a call to action. So listen carefully and pray with me. Eloheinu ve'Elohei avotenu ve'imotenu. God, that was the God of our mothers and our fathers. The God who spoke to us through Moses and Miriam and Abraham and Sarah and Jesus and Mary and Muhammad and so many other voices, who also spoke to us through Peter Brook, his memory for a blessing. A man who used to have to recycle his insulin needles, even though he had diabetes because he had no health care access, but fought for this law and got it passed. God, you are now speaking to us through our children and their children. This fight hasn't been going on for 20 years. It's been going on for thousands of years. Ever since the children of Israel rose up against Pharaoh and said, there is a better way. And once again, there's a new Pharaoh in the land who knew not Joseph and all that he fought for to bring food and bounty to the people. So folks, it's time to pray at this moment and organize tomorrow. Because God, we know you believe just as much in the possibility and in the hope that you provide and inspired us, God. We know that you believe in us. We're not going to stop fighting for another 20 years. We're going to fight forever because we have evidence-based faith and hope. God bless you, God keep you, and let's go forward together. Amen.
Amen.
Taught me how to pray.
Thank someone from the connector or from the governor's office on your way out if you enjoyed the event. And thank you so much. It was really a beautiful job.
Actually, yeah, no, here.
Let's take a picture.
Say hi. Tough kid.